Your Excellencies, ladies and gentlemen, esteemed distinguished panelists, it's my pleasure to welcome you to this very important discussion this morning. You know, we have a catchy title, but I think what's behind it is basically how do we prepare for next emergency? How do we prepare our health system overall for next pandemic? We all know very well, there will be viruses, there will be pathogens, there will be outbreaks. The idea is how do we prepare to contain those? How do we prepare outbreaks from becoming full-blown pandemics? We have been working on this for some time. Actually, this session links very well to some of the initiatives that the Center for Health and Healthcare at the World Economic Forum is working on. By the way, my name is Shyam Bishain, and I head up the Center for Health and Healthcare at the World Economic Forum. So we've been working on this. There is an initiative called Partnership for Health Systems, Sustainability and Resilience. Many of the folks here in the room are working with us on that. Basically, the idea is how do we prepare, as I said, how do we prepare the health system to respond to not just pandemics, but also other crises. We know there is a looming crisis of climate change. That's going to impact our health system. How do we respond to increased number of diseases, whether it's communicable disease, non-communicable disease? We have to prepare the system well for that. So that's an important discussion here. We also have initiatives in terms of biothreats, disease surveillance. How do we make sure that we have a good global disease surveillance? We have data systems that can be accessed quickly so that private sector can do their job. They can come up with medical countermeasures, whether it's vaccines, diagnostics, or therapeutics. So we've been working on that as well. We are looking at vaccine equity. We are looking at ways to make sure that there is manufacturing in various parts of the world. Africa was a big example, making sure that we have capacity there to make vaccines in case there is another pandemic. So those are some of the things we've been working on, but I think today we are really grateful for this distinguished panelists here to talk about this. Without taking much time, I will hand it over to our excellent moderator here, Dr. Nancy Brown. Nancy is the CEO, Chief Executive Officer of American Heart Association. Nancy, I will hand it over to you to introduce the panelists and take it on from here.
Thank you. Thank you, Shyam. Thank you all so much for attending this very important discussion. And I appreciate your opening comments. I have the highest regard for the Center for Health and Healthcare and the work that only the World Economic Forum can do to bring all of the actors together to address really important issues. I had the honor of serving as the chair of the Health and Healthcare Governors during January 2020's meeting when we first were planning for what we then know, of course, was a global pandemic. And I admired then, and I continue to admire now, how the World Economic Forum thinks ahead. And so, as Shyam said, the goal of our discussion today is to really talk about what can we and should we be doing to make sure our health systems are prepared for any future crisis that might come along that requires global collaboration and participation, and how can we be sure that we learn from the past to strengthen systems for the future? And that will be the goal of our discussion today. We do have a very esteemed panel of experts here that I'm honored to introduce, and in introducing each of them, I'm going to ask them to give some opening comments as well about the key components, very briefly, that each of them believe health systems should prioritize for an effective response to a potential crisis. And of course, it's our honor always to have Dr. Tedros with us, the Director General of the World Health Organization. And Dr. Tedros, may I ask you to answer that very simple question to start with? Thank you.
Can you rephrase maybe the question?
Yes, of course. At the highest level, what do you think health systems should prioritize for an effective response to a potential crisis?
Yeah, I think that's a big question, but I would like to start with especially the DiseaseX. It's attracting a lot of attention, and I hope you have seen in the social media. But it's not a new idea. The first time we used the terminology was in 2018. The discussions were in 2017. I was just new Director General. As you know, we annually list the emerging diseases. MERS could be one, Zika, Ebola, those we know. But then we said there are things that are unknown that may happen. And anything happening is a matter of when, not if. So we need to have a placeholder for that, for the disease we don't know that may come. And that was when we gave the name DiseaseX. So DiseaseX is a placeholder for unknown disease. I just wanted to start by clarifying that because there is already a lot of attention. If I may, although COVID came immediately, we were preparing for COVID-like disease. You may even call COVID as the first DiseaseX. And it may happen again. Of course, there are some people who say, oh, this may create panic. No. It's better actually to anticipate something that may happen because it has happened in our history many times and prepare for it. Yep. We shouldn't face things unprepared. We can prepare for some unknown things as well because there are basic things you can do. Then that takes me to your question, of course. Then we should prepare means it could be an early warning system that could be installed. And then preparedness planning. For instance, with COVID, we have seen it in preparedness planning when our hospitals were stretched beyond their capacity, but both in terms of space and also workforce. How can you have a surge when anything comes, you can expand quickly so you can manage your patients? We lost many people because we couldn't manage them. They could have been saved, but there was no space. There was no enough oxygen. So how can you have a system that can expand when the need comes? This, whatever disease, you should prepare for it. You don't need to know that disease. There are common factors. In terms of supply chain, for instance, the same. So whether it's in health systems or even the private sector, by the way, in research and development, for instance, you can prepare for it. Actually, it started with this DiseaseX issue with a research and development blueprint. It's a blueprint. And research and development should be at the center also to test drugs, to test other tools. And then, of course, the health infrastructure. I said it a bit, but the health infrastructure is bigger than what I said, the oxygen and the space. So preparing that in all its forms, especially with a focus on primary health care. High-income countries were surprised because their investments in the last many decades was on high-tech technology, cutting-edge technology in tertiary services, even robotic surgery, but their investment in primary health care was not there. Even some countries couldn't do contact tracing. So to prepare countries, I think renewed commitment to strengthen primary health care is very important. So it starts from there, and then, of course, we can go. Then the other is we shouldn't see it in terms of health services, in terms of research development, and so on. We should see it also in terms of communities. I mean, communities can prepare for DiseaseX. But there are many things that can be done at community level, and then public health education and communication should be at the center. So this is what I would like to say as a start. Thank you.
Thank you, Dr. Tedros. And we'll come back and drill down into some of those comments in a moment. Preetha, Reddy, thank you for being here from India, where you and your family lead a very large healthcare system, Apollo Health. I would love you to introduce a little bit about yourself and your health system, and maybe also answer the brief question, what do you think health systems should do to prioritize?
So I'm Preetha, Vice Chair of Healthcare private sector healthcare group in India. We've been there for 40 years. What we've done in 40 years, I think the learning over the past post-COVID has really, intensified what needs to be done. And DiseaseX, I know the name seems like a science fiction film, but basically it's something all of us need to be aware and alert, definitely for future times to come, because it's definitely a clear and present danger. I want to draw an analogy with the army, especially the Indian army. We know that every day the infantry actually prepares for war. They go through intense training, and at any time, if there is war at the border, they're ready to go and face that. I think healthcare workers, healthcare systems now have to look at the future like that at any time anything can happen, and we don't know which side it's going to come from, and there's no going away from that. So I think we have to prepare and be prepared. Like there are alerts for, global scenarios. For us, it's usually cyclone or floods. There's a red alert or an orange alert. I think the red alerts have to be flagged much quicker, which means we need to be able to realize that this could be potentially a huge problem. And for that, there's been so much of discussion about AI and how can AI really help us to find and detect the problem so early that we can actually plan and prepare for interventions. I think that is extremely important. But more than anything else, I am a very proud Indian, and I think that the leadership, the quick decisions, and the incisive decisions to do what we have to do at the right time, sometimes they're hard decisions, you've faced that, but I think to take the right decision, the hard decision, but to take a decision has been very important. And I think a population of 1.3 billion people, if we have been able to come out of this relatively, better than which could have been anticipated, and the fact that there was early intervention of vaccination, there was a lockdown. It was hard, but it was a decision-making which I think helped us. So I think that's important going forward.
Thank you, Preetha. Next, Roy Jakobs, who is the Chief Executive Officer of Philips Healthcare. Roy, I'd love you to say a little bit about your company and give us your perspective.
Yeah, thank you so much. Yeah, Philips, 133 years old. We're focused fully on delivering healthcare solutions by now. And we were very active also during COVID. And I think some major lessons we learned as a company, but I think also we should take away for the healthcare system. First of all, it's all about the patient. And I think that one of the big learnings during COVID was that actually you cannot treat the patient maybe like you would normally do, because you need to isolate, you cannot touch the patient. Also, what are the specific means that you need to ramp up very quickly, like respiratory devices, monitors? We had, of course, the vaccines. And how do you mobilize a supply chain globally to actually do that? So I think that's the second big lesson. Thirdly, it's all about the staff that needs to take care of these patients. And very quickly we saw that actually it became more and more challenging for the healthcare systems to actually keep the staff up and running, to keep them motivated, but also actually to protect them from the disease and keep doing their job. And then thirdly was, how can you then apply the latest also digital technology to help them in their daily jobs? Because there's a lot of technology available, but actually how do you then make sure that that quickly gets into the hands of the staff, of the system, and you can actually scale it very rapidly. Last but not least, next to the agility I think we all learned that we need to have, it was also about fair allocation of means. And as an industry player, that is not an easy task. And actually, we were very close with the WHO as well to make sure that actually in the allocation mechanisms that we had, that we made sure that everybody in the world could benefit from equipment. Because very quickly what you see, people get very centric on their own interest. And actually, if the system closes down and everybody only focuses on their own interest, actually we cannot solve a global crisis. So I think keep the world open, make sure that we allocate fairly, and that actually we keep the scaling up possible is something that we took away as some of our lessons.
Wonderful, Roy. Thank you so much. Next, it's my honor to introduce Her Excellency, Nisia Trindade Lima from Brazil, the Minister of Health of Brazil. And I would invite you to use your headphones as Her Excellency will speak in Portuguese. If you could introduce yourself and say a little bit about your perspective on health system strengthening.
Okay, thank you. Yeah?
Yeah.
Thank you very much. I will speak in Portuguese. Primeiro, eu gostaria de dizer que eu trago a perspectiva do Brasil a partir da posição do Ministério da Saúde, mas faço uma breve reflexão de caráter mais geral na linha do que fizeram os meus colegas que me antecederam. Primeiro, acho que o Dr. Tedros fez uma boa exposição sobre a origem do termo DiseaseX, doença X, mas eu penso que todos nós pensamos essa questão hoje à luz do impacto da pandemia de Covid-19. Foram feitas muitas avaliações no Brasil, e o primeiro ponto que eu gostaria de colocar é lembrar uma posição do sociólogo alemão Klaus Eder, que afirma que as sociedades aprendem, mas o mundo é difícil de mudar. Então, nós temos aprendizados da pandemia, mas nós precisamos de algumas forças transformadoras para pensar numa efetiva capacidade de resposta frente a possíveis a doenças com possível potencial pandêmico. Nesse sentido, ter sistemas de saúde resilientes é fundamental. Isso também já foi aqui abordado. Mas eu gostaria de iniciar também aqui mencionando que em situações de ameaça pandêmica ou num quadro de pandemia ou de epidemias que impactem em nível nacional de uma forma grave, há um fator que antecede, não que anteceda, mas ele organiza essas condições estruturais, principalmente de um sistema de saúde resiliente, que é o tempo da resposta política. Isso tanto a nível nacional quanto numa situação de pandemia em nível global. Há análises importantes a esse respeito. E, no caso específico do Brasil, do governo que antecedeu, o governo do presidente Lula, o que nós vimos foi uma resposta muito negativa diante da capacidade do sistema de saúde. O país falhou na resposta a essa pandemia, apresentando, entre outros indicadores, 11% das mortes por Covid, tendo uma população que representa cerca de 4%. Então, só para ficar nesse indicador. E o que fazer, então, daqui para frente? Alguns pontos que considero importantes. Primeiro, o investimento em ciência, tecnologia e inovação e na redução das desigualdades entre os países nesse sentido, especialmente no que se refere ao desenvolvimento e produção de vacinas, medicamentos, testes diagnósticos. Por essa razão, no G20, estamos propondo uma aliança no sentido de que se incentive essa produção em nível local e regional. Ao mesmo tempo, é muito importante que haja uma visão integrada da vigilância de possíveis novos surtos, novas epidemias com potencial pandêmico. Essa vigilância ela deve ser vista de uma forma integral, iniciando na atenção primária à saúde, como bem colocou o Dr. Tedros. E também fortalecendo os centros de inteligência epidemiológica no país para que essa vigilância possa ser melhor orientada. Nesse sentido, eu quero destacar uma experiência brasileira do Centro de Integração e Análise de Dados em Saúde, que é uma experiência que busca integrar dados, que é um outro elemento-chave quando pensamos em condições estruturais para a resposta a pandemias, integrar dados e ser capaz de analisá-los de maneira a garantir essa vigilância. Um dos projetos em curso é um projeto de alerta precoce de possíveis surtos de doenças, que integra exatamente a atenção primária, incluindo o papel dos agentes comunitários de saúde no país, até o nível da vigilância genômica, né? Então, creio que esse aspecto é muito importante. Por fim, nós temos como estratégia, em nível nacional, mas propomos expandir essa visão num debate de saúde global, a constituição de um complexo econômico industrial de saúde que permita organizar essa produção de insumos e reduzir a desigualdade, fortalecendo os sistemas nacionais, especialmente nos países de baixa renda, de média renda também, países em desenvolvimento. Por fim, eu quero chamar a atenção de um aspecto crítico, que é o estabelecimento de uma relação virtuosa entre a capacidade científica e a base de conhecimento científico e o processo de tomada de decisões. Creio que devemos também ter um olhar mais aprofundado sobre isso. Qual a melhor forma, não é, de fazermos essa associação, analisando de forma comparativa os vários formatos que nós vimos no próprio processo de resposta à pandemia de Covid-19 e em outros contextos, como o Ebola, não é, e a sua relação com a criação do CDC África, entre várias outras iniciativas. Ou seja, colocar no centro da discussão qual é a melhor forma de ter políticas públicas definidas a partir dessas evidências científicas, de um lado, e fortalecer os sistemas de saúde numa perspectiva integral de outro, que creio que sejam os melhores caminhos para isso. E, para finalizar mesmo, nós estamos no momento de discussão de um instrumento para pandemias no âmbito da Organização Mundial de Saúde, e eu creio que a saúde sozinha também não pode dar conta de todas as discussões. Então, incluir nesta agenda os sistemas de proteção social, né, que são fundamentais em tempos de crise, né, como o que vivemos recentemente. Obrigada.
Thank you, Her Excellency, and I really agree on this with all that you've said, especially the last point about the expanding outside of healthcare, those systems that must be part of our response. Next, I will introduce the kind gentleman to my left, Michel Demare, who is the chairman of the board of AstraZeneca. I wonder if you'd like to give us your opening comments.
Yes, of course. I think what we can say, first of all, is that a good preparation for a crisis happens when there is no crisis. And so having a panel like this here is already a great start, because you have all the players of the healthcare ecosystem represented here, because at the end we have to all work together to try to address it. Now, as you said, I'm the chairman of AstraZeneca. That obviously has played a pretty special role during the COVID crisis, and I think we have a few lessons that we can share from this. Just as a reminder, we were not a vaccine company at the time. We just decided that this was a call for action, that we had to try to use our know-how and our networks to try to help. And so we signed a license agreement with the University of Oxford. We then put together a network of more than 20 contract manufacturing organizations to whom we transferred technology and skills to basically help building the vaccine, which is it's not like building a pill, it's much more complicated than that. And then finally, we managed to distribute more than 3 billion doses of vaccines at no profit, of which more or less 2/3 went to low and medium income countries, mainly through COVAX, which was obviously a very important organization at the time too. and obviously that you are here to witness this. What I think is important, if you draw the lessons from this experience, first of all, quick action, quick decision making, extremely important, but even more important, partnerships, and especially PPPs. You have heard me, we have partnered with academia, obviously with governments, with regulators, with third-party commercial contractors, and with NGOs. And it's only because of that that we finally managed to distribute the largest dose, actually, of COVID vaccines during this crisis. So that is lessons learned, but I would say a spontaneous reaction, because the crisis was at the door when this happened. If you think back a little bit, say, oh, could we better prepare next time? We put a lot of emphasis nowadays on sustainability and resilience of health systems. We have seen that health systems were not prepared for that last time, not only to handle the sheer volume of COVID cases, but some examples, for instance, in the UK, it is estimated that 1 million cancer cases were not diagnosed during COVID, just because of lack of resources in the health system. So obviously that cannot happen. It is a transformation that will take a certain time, and I would have basically 3 recommendations for that. First of all, I think it's important that health become a strategic asset for every country. And it's not always the case, I can tell you that. We do that for energy, why not for health? Is there anything more important than the good health of your population? Because good health drives prosperity, drives work efficiency, and so economic growth. And so we have really to work on that. There's a McKinsey study that says that with good health, we could add $12 trillion to the global GDP by 2040. That is quite an impact if we work on it. So that is point one. The second is, it's not just about spending more, it's also spending smarter. And a shocking statistics, for instance, in OECD countries, the average spend on prevention is 3% of the budget of health systems. And obviously, if you spend so little on prevention, you end up spending the majority of your budget on hospitalization and on late treatments. So there's a lot of change that needs to happen there, and that can be extremely useful. And then the third one is obviously we have to build on technology, on data management, on artificial intelligence. I agree with you, there's a lot to do. We can start building across the board the libraries of viruses, of vaccines, share our data with each other, because it's quite important when it happens. And then artificial intelligence can also help a lot, not only in drug discovery, there's a lot of potential there, but also in the administration of health systems and trying to rationalize and to make sure that finally most of the budget is really spent for the primary care and for innovations rather than being always reactive. So I would hold it here for the moment.
Wonderful ideas. Thank you. Thank you so very much. And we'll come back around on several of those. Dr. Tedros, I would like to come back to you. Obviously, the World Health Organization is in the unique place to assure global collaboration among countries. And certainly you have some work products underway to address these emerging challenges and to promote sustainable improvements in healthcare delivery worldwide. Wondered if you could share a little bit more about your plans in that regard.
Yeah, no, thank you. I think I should start from thanking AstraZeneca also.
Thank you.
What Michel said is correct. I think he asked, also said my friend to attest to it. Since I'm here, I hope I represent both of us. And AstraZeneca, the vaccine, has reached many developing and middle and low-income countries, and the volume he said, and we're very, very grateful. So we know that, and the technology transfer you have made with other countries to produce, and I think that really helped, and that could be a model for the future. So I fully agree with what you said with regard to AstraZeneca's contribution, and where recognition is due, it should be given, and this is an honest witness. I think Seth is saying that. So thank you so much, Michel, and AstraZeneca. Then on the issues, I think to prepare, of course, as I said, after we started putting a placeholder, the first that came was in the DiseaseX is COVID. So we have experience now. and we are preparing based on that experience. A lot of assessment has been done by independent panels and experts. And based on the recommendation, many initiatives we have already started many initiatives. And one is together with many partners, by the way, it's not just WHO, but with many partners, for instance, with the World Bank and other colleagues, we have established a pandemic fund. So that's basically for preparedness, and some countries have already benefited from it, and second round is in the pipeline. And then there are enhanced systems tools we're working on. For instance, one of the problems, as you may remember, is the equity. Again, while thanking AstraZeneca, it was a serious problem. Many countries, high-income countries, were hoarding vaccines, and low-income countries were not getting vaccines. Access was a problem. And to address the equity problem, we have established the mRNA Technology Transfer Hub in South Africa. This is to increase local production. And 15 countries are participating, and Brazil is one, which is already represented here. But there are countries represented almost from every region: Europe, Asia, the Pacific, Latin America, Africa, and so on. So that's going well, and we hope we will have an increased production capacity that can address the equity problem. And there are still in systems and tools, there were weaknesses, as we all know, in surveillance, in sharing samples, and we have established the WHO BioHub to share samples and to improve surveillance. We have the pandemic intelligence, collaborative intelligence hub, which we established, and it's up and running now. It's in good shape. And there are other things we're doing. I don't want to bother you outlining everything. There are things we're doing with workforce, but the key is the capacity we build in each and every country. We are as strong as the weakest link. So where are we weak, and especially at the country level, that's where we should focus, while also investing in the global initiatives that we have started. And then the other key, in order to have better prepared and to address the disease, is the pandemic agreement. The pandemic agreement can bring all the experience, all the challenges that we have faced, and all the solutions into one. And that agreement can help us to prepare for the future in a better way, because this is about a common enemy. And without a shared response, starting from the preparedness, we will face the same problem as COVID. And deadline for the pandemic agreement is May 2024, and member states are negotiating. This is between countries. And I hope they will deliver this pandemic agreement by that time, on the deadline. Because if this generation cannot do it, we're the lived community, we have the first-hand experience, I don't think incoming generation, the next generation, will do it. So for our children and grandchildren's sake, I think we have to convert all the lessons we have learned into this pandemic and prepare the world for the future, because this is a common global interest, and national interest, very narrow national interest, should not come into the way. Of course, national interest is natural, but it's the narrow national interest that could be difficult and affecting the negotiations even as we speak. So we're still not prepared, but I think there are many moving parts we have started, good ones, all of us together, that can prepare us better if we focus on the implementation of these initiatives. Thank you, and back to you.
Thank you, Tedros. Michel, may I come back to you for a moment? AstraZeneca is a co-founder of the Partnership of Health Systems Sustainability and Resilience, a really important initiative of the World Economic Forum. Tell us about some of the solutions this partnership is driving and how that is going to help us be prepared, across borders.
Yeah. With pleasure. It's a partnership that was also born out of the crisis. We started that in 2020 in partnership with the London School of Economics and with the WEF. And after that, we had other partners joining us, like Philips and KPMG. The idea is really to try to make an assessment of all the health system in the world. So far, we have gone to 30 countries to do that, and to produce a report, with the conclusions, but as well all the recommendations that we can do. We then kind of take over with our partners and organize roundtables in each of the countries where we try to put together all the actors of the ecosystem and really try to work on solutions, get them. And what you see is more and more we get there, and it becomes a source of inspiration. I can give you a few examples. For instance, in Greece, where based on the recommendation, they started a whole program for scanning chronic kidney diseases and trying to anticipate that. Or in Japan, where based on the recommendation, they finally managed to consolidate all the data in one electronic system that they can use for the future. So these are a few examples that can be done. We continue to work on that because at the end, it's each of these small initiatives for which each time we can find the right partner and maybe also a different way of financing that will help turning this financial resilience of health system into a better situation.
Yeah, it's really fascinating. And Preetha, I'm going to come to you because you can speak about this topic from the health system point of view. And of course, India had the recent G20 presidency. And I would love for you to tell us a little about how Apollo Healthcare Systems are aligning their efforts with this international agenda that we've been talking about.
Thank you. I think, the G20 presidency was definitely something which made us very proud. But more than anything else, it set systems, and there was a lot of work which has gone into it and commitments made that we have to handle healthcare for the future. One of the issues which came up was the rising burden of infectious diseases, and how can we put good, strong vigilance systems into our healthcare, especially with the fact that, a lot of India is not really in the urban regions. There's a lot of rural, and we have 600,000 villages, and how do we use technology to reach out to it? It was a very strong focus during the G20. And using technology, using telemedicine to reach out to the rural population was one major initiative. The other is, and there's been so many conversations, especially at the forum, is about women's health and gender equity. So it was coined as Tequity. And women have to have equity in, they have to have a seat at the table at every instance. Also, the fact was that half the world's population, 49.7% of the 8 billion, is actually women. But research is not skewed completely towards a 50-50 partnership. And I think that more focus on research, which will treat not only the women-related diseases, but all-encompassing diseases, maybe cardiovascular or the orthopedic diseases. I think this came into a lot of focus at that time, and so Tequity became very important for us. The lack of skilled manpower, and it's a global shortage. We just do not have enough doctors and nurses to heal the world. So using technology, how could we help them access? So I think digital learning tools, training tools had a great focus. Apollo did it during COVID, that within a span of 2 weeks, we were able to train about 150,000 workforce on ventilator management, because while there was a shortage of ventilators, even if there were ventilators, we didn't have enough people to be able to use it. And I think this kind of took the global fancy, and there's been a lot of training, small modules, but for healthcare workers, for the aging population, for bedside care, and for multiple other requirements. So I think that was, again, a part of the G20 presidency. A strong focus on AI and digital, I think, got discussed in every fora, and we know that health is a very strong backbone, and so AI in health, digital reach in health was a huge focus. We know that the NCDs kill 41 million people each year. and it's 74% of all the deaths globally. And so the awareness on NCDs, dealing with NCDs and the antimicrobial resistance, I think the AMR again was a huge focus, and G20 is looking for solutions for that. One initiative which was very intrinsic to our part of the world was the focus on alternate medicine systems and Ayurveda and all the other healthcare systems, and how could we come out with integrative healthcare. So maybe we could do the diagnosis using high tech, but can we use these ancient systems of medicine for areas where it's not really required to use very strong allopathic drugs? So I think that was one of our discussion points also. But more than anything else, it was about collaborating to give access to the underserved, whether it was financial or geographical access. How do we make health systems more accountable for the outcomes which are so important to us? And then how do we collaborate and to be able to quickly turn around the things which have been challenging us in the future? So I think all these discussions were useful during the G20, and Apollo played a very intrinsic part of that as part of the leadership team.
It's wonderful. Thank you so much. And you focused a little in your comments about the digitization of healthcare. And Roy, I'd love to come to you on that topic. Philips certainly has been a leader across the world and very focused here at the World Economic Forum on these topics, including value in healthcare. I wonder if you could give us your perspectives on how these tools can help us be prepared for any future crisis our healthcare systems might face.
Yeah, sure. So I think we are very concerned about access to care in general. I think we saw that is challenged when you have a crisis like COVID or any kind of infectious disease that could come after. But even today, actually we lose more patients to cardiac disease in a year than we have lost to COVID. And that is also because we cannot operate at capacity anymore. And if you then look at the productivity of the healthcare system, why are we not as productive as we can be? Is because actually the learning agility and the adaptability to what is possible is not yet fully there. And we saw actually in COVID what is possible if you look at it systemically. And what I mean with systemically, if you look to what technology can do, we can scan 3 times as many patients if you use AI now on an MRI. We can actually predict within 24 hours, even within 2 weeks, if a cardiac arrest will happen. But you need to have the clinical practice to adopt these technologies. You also need to have the financial system to support and reimburse some of these new practices. And then you need to have the regulatory system that actually allows this to be adopted. So if you have these 4 lining up, then actually you get massive change and adoption. And we saw that with COVID. Unfortunately, what we also have seen, actually, there's backtracking. So funding is going away from some of the digital technology or remote kind of services that we were providing. Some of the kind of regulatory frameworks are becoming more contingent in terms of how you deal with data and instead of what data can allow for. So I think for us is we keep pushing the technology boundary. There is a lot possible, and we talk a lot about that in AI. And it's not talk, it's what we can do day to day in the workflow of healthcare. But we need to work together to actually really get that massive change going. And that's something we are very passionate about, and these kind of forums help to actually mobilize the whole system integrally.
Wonderful. Thank you. And Her Excellency, I'd love to give you the last question in our time together today. As Brazil takes on the presidency of the G20, tell us about some of the investments that you see that will be made in terms of helping us address these issues of health system preparedness.
Well, eu havia mencionado anteriormente, né, em termos de preparedness, prepararmos para possíveis emergências. Primeiro, creio que seja muito importante o fortalecimento dos sistemas de saúde. Esse é o primeiro ponto. Esse investimento deve se dar na atenção primária, mas eu creio que cada vez mais a noção da importância da coordenação de todo o sistema de saúde. Então, esse fortalecimento da autoridade sanitária. O segundo é promover uma equidade em ciência, tecnologia e inovação. Rapidamente dou o exemplo durante a pandemia de Covid-19 do Brasil e particularmente participei dessa iniciativa quando era presidente da Fiocruz, que foi a encomenda tecnológica da vacina para a Covid-19, desenvolvida pela Universidade de Oxford, que nós fizemos o acordo com a AstraZeneca e tivemos a oportunidade de ter a incorporação dessa tecnologia. Então, é muito importante, queremos levar para o G20 o fortalecimento de alianças em nível local, em nível regional e global para isso. Um terceiro aspecto na preparação é o fortalecimento dos sistemas de vigilância, com integração de dados, também com a integração desde a atenção primária à saúde. Portanto, a preparação diz respeito a atividades de ciência, tecnologia e inovação. No caso, temos que pensar que 90% das patentes estão concentradas em 10% dos países, então essa é uma das transformações que eu creio que seja necessário de se pensar. A outra questão também relacionada a esse aspecto é de fortalecer cadeias de produção, ecossistemas de produção em nível regional. E fortalecer também o papel da cooperação entre os países do G20 e fortemente a questão do multilateralismo com fortalecimento de organismos como a Organização Mundial de Saúde. Também, dentro desse conceito de preparação, incluímos, como eu disse, a ideia de uma integração de dados, o que requer o fortalecimento da saúde digital. Então, por isso que propusemos, como coordenação do G20, é que ao lado da preparação, o tema da equidade no acesso à saúde, da saúde digital, também estejam fortemente presentes. E, recentemente, eu falei agora há pouco, mas recentemente foi publicado no Brasil um relatório pela Academia Brasileira de Ciências avaliando exatamente esse papel da inteligência artificial no sistema de saúde. Aspectos positivos que vão desde o diagnóstico até tratamento, e integração de dados para análise de cenários epidemiológicos também, mas, ao mesmo tempo, preocupações, tanto com a educação quanto com o desenvolvimento dessas tecnologias nos países em desenvolvimento de baixa renda. Então, creio que são esses os aspectos que eu gostaria de enfatizar.
Thank you.
Wonderful, thank you, and certainly a bold agenda. And I think I feel very comforted in knowing that all of these leaders and Dr. Tedros, who had to leave for another engagement, are all very focused on these issues. And the World Economic Forum, again, I would like to just say, is a hub for all of this global collaboration to happen together. So thank you to each of the panelists for your participation, and thank you all for attending today.
Thank you.